what a physician assistant is. So we'll be talking a little bit about the college itself, why you should consider RCSI as a college, and then we'll be talking about more about physician associates, as they're referred to in Ireland, and a little bit more about the course. And at the end, we will have time for questions that you might have. Also, we'll be hearing from students, so you can hear directly what it's like to be a student in our program. Okay, next. So RCSI is one of the older institutions. It was established in 1784 in Ireland. It has been in the top 2% rankings by the Higher Education World Ranking in the last few years. And again, in 2020, there are 3,800 students in RCSI Dublin, but we also have 4 international campuses as well in the Middle East and Malaysia. 9,000 surgical fellows and members, as well as the physician associate program. The picture you see here is of the new, or fairly new, simulation building in which our PA program has access to, and our PA's students were actually the first ones to use this building when it opened up. Next slide, please. RCSI numbers, again, we're ranked in the top 2% or the top 250 world universities. In the international, we have students from over 68 countries, with 4 international campuses in Bahrain, Dubai, and Malaysia, 2 in Malaysia. Student population around 4,000 registered students and staff. Next slide, please. So what is a physician associate? That's why you're all here. So a physician associate can be defined as a healthcare professional that is trained at the graduate level and qualified to provide medical services to patients within a defined scope of practice under the general supervision of a doctor. In other words, that they do practice medicine within a scope with a doctor that's available for consultation and oversight. Next slide, please. So where did PAs come from? The physician associate, or a physician assistant, as they're called in the United States, began in the US back in 1965 when a doctor named Eugene A. Stead at Duke University Medical Center had this idea of creating what was then called physician extenders in response to a shortage of doctors in especially rural areas for primary care. So he chose a cadre of first students, which were former U.S. Navy hospital corpsmen and medics. You think of them as paramedics that served in the military that had advanced training to take care of soldiers and sailors and battlefield medicine. He then created a curriculum, was based on a fast-track training that was used to train doctors during World War II. So they couldn't wait for the 5 years or 8 years or 10 years that it took to train a doctor. They needed doctors immediately. So they created a 2-year fast-track program and trained doctors during World War II. That same curriculum was taken and adapted and implemented for a physician assistant program in 1965. Next slide. So where are physician assistants today? So the PA concept has really taken hold across the world. Many countries have adopted or adapted the role of a physician associate. They may be called physician associates, physician assistants, and in some areas clinical associates, but the role is fairly similar. So we have physician associates in Ireland. Yes, we have in Ireland. Some of you may know someone that's a physician associate or have heard of one. The US, certainly, they have over 140,000 physician assistants in the US. Canada, Germany is the fastest growing country for physician associates. The Dutch in the Netherlands, and other countries too numerous to mention. Next slide, please. So the RCSI Physician Associate Program began in 2015 with an inaugural class of 6 students. They start in January, complete in December. And so in December of 2017, we had the first qualified physician associates. Because our program our academic year runs from January to December, which does not sync up with the college normal September to May, these students then receive their conferring the following May of 2018. However, they are qualified to begin work as soon as they finish the course successfully in December. Cohort 2 was in 2018 with 13 students. Then we added 10 more students, and then 10 students in cohort 4. And so you can see that we kept the class size small. The cohort 5 included 14 students, so we're slowly growing our program. We pride ourselves in having a smaller class size, which allows more one-on-one instruction and individual attention of students. Next slide, please. So physician associate studies was sort of the course offers sort of focus on patient care. All of our curriculum is designed to eventually center on the patient for patient care. We do that by using our simulation facilities that were world-class. We have placements and work across the healthcare environments from different types of healthcare institutions. PAs become a vital member of the multidisciplinary team in a demanding, fast-paced immersion experience. Clinical placements start from year 1 for clinical immersion and continue on in the entire year 2. So at a glance, you can see on the other side how many students we have. We have 52 PA students since the beginning. We have 28 graduates, soon to add more. Faculty, as myself as program director, Dr. Pauline Joyce is our academic director, and Laura Kenna is our program coordinator. Next slide, please. So the PA growth has been tremendous since 2015. From the US, we went from 108,000 PAs to over 140,000 PAs. There are 200 programs in 2015. Now there are over 200, actually over 270 programs in the United States. In the UK, went from 100 to 1,200 PAs, and actually this is much higher now with new graduates. The 5 programs in 2015 went to 35. So you get a sense of how rapidly the growth of this profession is. In the United Kingdom, the profession is represented by the Faculty of Physician Associates, and they are responsible for ensuring that there is a national exam to ensure uniform competency of graduates. Also, they manage the voluntary registry to sort of credentialing, and the government has decided to regulate physician associates under the General Medical Council. So the Irish Irish Society of Physician Associates is an Irish organization that represents PAs in Ireland. Again, they also have a managed voluntary registry, and a national exam was first administered in January of this year and will continue for each graduating class. The image on the right-hand side of your screen gives you a snapshot of what PAs actually do. So they anywhere from basically the total care of the patient within the scope of practice. We're taking medical histories, carrying out physical exams, order investigations and check results, make diagnoses, formulate treatment plans, and they also assist in surgeries in the theater. Next slide, please. So at this point, I will turn this over to Dr. Pauline Joyce, our academic director, and she can talk about what our curriculum is like.
Okay, thank you, Denny. So this slide represents our curriculum, and it's showing you that it's not a straightforward curriculum like you might have experienced at primary degree level. So we call this curriculum, I suppose it's very integrated, like a spiral curriculum, where you start one module, but also there's other modules going on at the same time. So it's quite an intense program, but there's so much to be learned, for instance, under Foundations of Clinical Medicine, that you couldn't just do all of that every day, 5 days a week. It's a lot to take on, and I'll explain what's under the different modules in the next slide. But you can see we have Foundations of Clinical Practice, Clinical Medicine and Practice, applying what you've learned in the foundations, Pharmacology and Therapeutics, Personal and Professional Development, and Evidence-Based Practice in Healthcare. And running right through that is Experience in Clinical Practice. In year 2, there is a dissertation, which is a Quality Improvement Project Plan, and this is very much focused on the clinical area. Physician associates are in a prime position to get involved in quality improvement, in improving things at the hospital level, in this case for the project, for the patient. What will make healthcare better for the patient? Following COVID-19, we're going to have huge issues with waiting lists, people coming to clinics or not coming to clinics. So there's a great opportunity for physician associates to plan improvements in patient care to deal with these issues. So very briefly on the modules, the Foundations of Clinical Medicine. This is where we do anatomy and where we don't do physiology, we do anatomy, and we do this in the dissection lab. So this is the same type of training that the medical school students get, but this is in a very confined space in one semester, and this is quite intense for students. Then the students start in the systems of the body, working right through from the head of the body right down for the different systems. Again, this is done in a very shortened time frame, so it's quite a bit to take on, and this is why we are very careful in our selection of students for this program, because we don't go back to the basics. We expect that you have a lot of the knowledge coming in and you build on this knowledge. So the systems of the body is quite a lot of work, so you can imagine if you're doing both of those subjects right through a module, it would be too intense. So what we do then is we bring in module 2, which is the application to what you've learned in Foundations of Clinical Medicine to practice. And how we do this is we take a case. So we start off with a simple case. It might be somebody having a sore throat, and then you link back to what did you learn about in the system of ear, nose and throat, and how can you apply this to the case? How do you take a history from a patient coming to you with different signs and symptoms? What physical exam would you do for this patient to come up with a diagnosis, investigations, treatment plan, like the infographic that Denny spoke about in a previous slide. Alongside this, you know yourself from interacting with healthcare that to treat a lot of the conditions that the patients get, and yourselves have got as well in the past, that there will be an opportunity to look at what drugs will work best for this illness, if you like, or condition. So this, again, a very intensive module, and some of the class reps that will talk to you later can answer some questions on this. This is a very intense module, again, going back into the pharmacodynamics and kinetics of the drugs, how they work, what drugs will be used to treat the illness. In module 4, personal and professional development, we bring this in early on as well, because we want you to start thinking about this master's is not just about a qualification, but this master's is also getting you ready for a new profession, and it's a profession in healthcare. So there's lots of things you need to find out about yourself first. How are you in going forward, you know, as the healthcare professional dealing with patients? What are your personal preferences? What do you know about yourself and how you would work in a team? What do you know about how you learn best? what do you know about your leadership skills? So these are vitally important for you going into a profession which is new to the Irish sector. So you need to know a lot about yourself, so then you can work on that to become more familiar with your other healthcare professional colleagues and integrate well into a team. What is the role of a PA? So we use the term PA, or the abbreviation for short, physician associate. So what is your role in comparison to the doctor, the nurse, the occupational therapist, etc.? So we have a lot of discussion around that, and we have qualified physician associates coming from the US, as Denny is, who play a significant role in the programme in teaching you the role of PAs who have been around for over 50 years. So already I've mentioned about team working, leadership, communication I haven't mentioned, and that's so important, how you communicate and how you will be communicating with patients. And you have an opportunity to test out all of these skills about yourself in the simulation unit that Denny pointed out in the second slide there. So we spend a lot of time getting you to communicate with simulated patients, we call them. We get you to practice with each other. So not just verbal communication, but your non-verbal communication as well. So these are vital. So it's not all about academic work on this programme. It's very much about you as a person and your professional development in entering a profession like this. The fifth module, which we introduce also in year one, is evidence-based practice in healthcare. So here we give you an overview on research, and then we go a step higher, evidence-based practice. So the umbrella that incorporates research-based practice, and then the practice applied to healthcare and the experience of that. Does this actually work in healthcare? So we give you some lectures on evidence-based practice, and I also introduce journal clubs very early on in the course so that you get very familiar with reading papers on different topics to do with the physician associate role, and also then to do with illnesses and diseases under the different systems. So finally, I just mentioned the dissertation in year two, and this is quality improvement and patient care. So the second years are currently, who are going to talk to you, Aaron and Natasha, soon. They're currently in the midst of this. How can I make an improvement in something that's going on now that will better patient care? So what you can expect during the programme, and we've already summarised this in one of the slides that you saw earlier, but just to re-emphasise it again, from the start we focus on patient care. So we're quite strict on how you present yourself on a day-to-day basis, even in the classroom, because we're getting you ready all the time to go out there and represent this profession. You're within the School of Medicine, so the same rules apply, that there is always a focus on patient care. The patient is at the centre. One-to-one mentoring and advice with PA graduates and with second year students. So if you're in first year, you have a mentor in second year, and the students who are in second year have mentors in the PA graduates. We offer blended learning and peer-to-peer learning, and of course you know now we're all online learning at the moment. We'll talk about that in a minute. But the blended learning involves maybe receiving some slides in advance, maybe work in advance to look at before you get the lecture or the small group teaching in the classroom. And peer-to-peer learning for us is very important, because we know that in every group we get into this programme, there's lots of experience within the group. And that's not just healthcare experience. So we get a mix every year of people from a background of healthcare and people from a science background. So what happens is that the people from the science link up with the people from healthcare, and they use the best skills of both to teach each other. So particularly when, say, somebody with a nursing background, for instance, is learning the pharmacology and therapeutics, well, their strengths are not, there necessarily, and they would lean on one of their colleagues to teach them the physiology and different pathologies, from a pharmacology therapeutics perspective, and also when they're getting into the systems perspective. So we encourage that quite a bit, and you will find that you will be doing a lot of presentations in class to each other as well. Currently, during COVID, we've continued on with the programme. So the college was shut down on the 13th of March, and the next day, the 14th of March, we were straight online. And we have a system via Moodle, which is called Blackboard Collaborate. So that allows us to work from home, which we're all doing at the moment, and teach the content via this platform. And there is interaction from the students, so we can use cameras, audios, we can tape record the sessions, etc. We can use breakout rooms within this session as well. So this is how we're continuing our business at the moment. Simulation facilities, I've said already, with the simulation unit, that big building that Denny showed you on the second slide. We do get, we call them real patients, as well as simulated patients. So the simulated patients are patients are the public that we get in, and we give them a scenario and they role play that scenario for the students to take their history and do the physical exam. We also get patients who've been to the hospital and have lots of times complex histories, and we generally get those patients for the second year of your programme. You would be working across healthcare environments, and we integrate that into the programme very early on, and for you to appreciate the roles of other healthcare professionals. So you could have a talk from somebody in nursing or in physiotherapy, in pharmacology. So we introduce some interprofessional learning as well. You can expect that we prepare you for career and enhancement very early on, in that we get you to fill out these self-development questionnaires about yourself. We also, towards the end of year 1 and certainly into the beginning of year 2, we ask you to fill out your CV. We get your peers to, swap your CV with peers and get you to start thinking about every clinical rotation you go to is an interview really for a job thereafter. So we get you thinking about how your CV looks from the very start. And I know that we're probably one of the few programs that do that, because I've been talking to colleagues in other programs and they don't give an opportunity to students to do that. So we feel that's really important, that you have a goal in mind at the very start. We focus on you becoming a vital member of a multidisciplinary team. We're not saying that where you are on the hierarchy is below anyone else, but more or less that you feed into lots of different roles in the hierarchy, in the medical hierarchy. But first and foremost, you're reporting into a consultant. So you're working at a high level in the team when you finish off, but that's not to say that you don't integrate with every other member of the team in the hierarchy. So we talk a lot to you about the variety and scope within your role as a physician associate and the roles that are available to you after qualification. Clinical rotation sites, we've, I suppose, started off in the programme with working with the sites within the RCSI hospital groups. I don't know how familiar you are with them, but you can look them up afterwards. So within the RCSI hospital group, you have 7 different hospitals, and that will probably change if you're in touch with what's happening at a national level. They're looking at reassigning the hospital groups. But at the moment, what has happened is there's a university assigned to so many different hospitals around the country. So we've started with that in mind, but we've had such an interest in the physician associate profession that sometimes people from other hospital groups, so beside Kappa Hospital, that's IEHG, which is Ireland East Hospital Group, we were approached by them. Now, since this slide even, we've been approached by other hospitals within the group. So we've been approached by the Mater Hospital. We have got graduates there. We've got graduates in Navan Hospital, which is also under that group, and more coming on stream. The same in Waterford Hospital, so we're not all Dublin centric. We have a graduate in Waterford Hospital at the moment. We hope to have a graduate in Cork soon, and we're interacting with the University of Limerick as well. So lots of opportunities. GPs, we also rotate our students to GP practice. So we're looking at, you have a prime role in primary care settings as well as secondary care, the hospital settings. So this is part of the programme as well. In the specialties, we have obstetrics and gynecology through the Rotunda Hospital, which is within the RCSI hospital group, paediatrics via Temple Street and Crumlin Hospitals, soon to become the one big children's hospital that's been built, and then mental health via Bloomfield, Highfield, and sometimes Beaumont, with there's limited places there. The private sector have been very interested in the programme, so where different sectors show an interest, we do sometimes send students there with a view to getting employment thereafter. So some of them here, and these are expanding all of the time as well. Blackrock Clinic, for instance, we have 2 graduates there. Bon Secours Health Group, we have 1 graduate in the Bon Secours at Glasnevin. The Hermitage Hospital take our students, and we'll be looking at taking graduates down the road. The Mater Private in Cork, we have a graduate there. Galway Clinic, we have 2 graduates, and Even Hospital in Kilkenny have taken our students in the past. So we have a mix of assessments on the programme, and to go alongside that, we have lots of different resources for you. So we have MCQ multiple choice exams, including, we do them online obviously at the moment, but we have quite a lot of MCQ exams throughout the programme. And we also do short answer quizzes, which we introduced this year, and these seem to be working well with the students, so they let us know as you're going along if you're struggling in any particular area, and also you can bank marks from a very early stage in the programme. Clinical exams, so you have to simulate a patient or a patient, and your examiner will check in to see if you're doing that accurately, etc. Different assignments that you write up, and sometimes these are in pairs and mostly individual. Presentations, so you use maybe PowerPoint slides, or you might get up and present something in the classroom. We use flip charts. We also have a smart white wall for a full side of the room that you can write on the wall. So lots of different ways of giving your presentations, and we really encourage that, because that is going to help with your personal and professional development as well. Because in the hospital setting or in the GP setting, you will have to present back to your supervising consultant. We use quite a lot of case studies, so sometimes those case studies are fabricated and we get the simulated patients to take on the role, or other times the case studies are real case studies that the patients come in and tell you about. We also actually get patients into the classroom to talk to you as well about their experience of healthcare. We use a clinical skills passport, which contains the different skills that you get training on and that you're assessed on. And this will be useful again for when people say, when you go out on practice, well, what skills can you do? What have you been taught to do? Clinical rotation sign-off then is about when you spend 3 or 4 weeks on a service, you have to present a patient case to your supervising consultant or the next person in line, which would be the registrar. And they mark you off on whether you've done that satisfactory or not. So you need to do that every 3 weeks during a semester, and they have to be uploaded onto our Moodle site, and you get marked on that. And the QI dissertation, quality improvement dissertation, I already spoke about. So the resources we have physician associate clinicians. So we have physician associates on our faculty. We also have a number of graduates now out in Beaumont and in other hospitals, and they become actively involved in the teaching as well. We have our online library. We have online resources, including videos that you can access. We have our online platform Moodle, and we have our simulation centre. And within that as well, we have an opportunity to video record your session when you're doing history taking with a patient or physical exam, and you can receive that video directly into your email for you to look at yourself. So following feedback from the examiner and from the patients themselves, you can also do your own feedback on how you performed by looking back on that video. And we have access to medical and other schools. So the foundations of clinical medicine will be taught primarily by the medical tutors. They travel from Beaumont or Connolly hospitals across to Stephen's Green when we're in class to give those sessions. And since we're online, they do these online in an interactive session as well. And Denny spoke about the national exam, but we might come back to that if there's questions about it. So maybe I'll just hand back to you, Denny, if you want to just take this slide.
So yes, thank you, Pauline. So there are various groups. One is we did have the 2020 virtual conferring, which is actually on YouTube video that you can find if you do a search. The Irish Society of Physician Associates does have a website that's up and running. You can, the link is displayed here, Irish Society of Physician Associates.ie. It can give you a little more information about the profession. Picture here is the graduates who are the board members of the board of directors of ISPA. All graduates are eligible for membership in ISPA, and we encourage that. We also spend a great deal of time and energy in helping to promote the profession and help, assisting and consulting with the ISPA to further establish the profession here in Ireland. Twitter account, if you want to follow, it's RCSI_PA studies. We often post either pictures or events or things that are going on with our PA program. And here's a picture of some of our current students, about 2 years, both year 1 and year 2. Okay, next slide.